Hello, good afternoon. My name is Dr. Nida. I'm one of the senior registrar over here. I believe that I'm talking to Mr. Crickbright,
Yes, doctor.
father of 9 months lovely boy Jackson.
Yes, doctor.
So, Mr. Crickbright, today we are here to discuss about the health condition of Jackson.
Mm-hmm.
So, Mr. Crickbright, before starting our discussion, I want to ask that how are you and how you are doing right now?
Doctor, frankly speaking, I'm quite worried about my son.
Mm-hmm.
I'm in fact waiting for you to update me about him.
Mm-hmm. So you're waiting. Uh, Before starting our discussion, do you want anyone else to join our discussion?
No, doctor. You can discuss with me.
Okay. So what's the latest update regarding Jackson?
Doctor, I just know that Jackson is having pneumonia.
Mm-hmm.
I came here yesterday night and Jackson was admitted here.
Mm-hmm.
And right now, he also received a dose of antibiotic. What what I
Mm-hmm.
was told by the doctor who was on
Mm-hmm.
duty yesterday night.
Okay.
And in the morning, when I inquired about my son, I was told that Dr. Nida will be coming to update you about Jackson's condition.
Okay. Okay. So
Doctor,
as
is
far as
everything fine? Uh, because my wife is continuously calling me and asking me about well-being of Jackson.
well, Mr. Crickbright, I must appreciate that how keen parents you are and how taking care of your kids, is really appreciated. So here I am here to discuss about the Jackson's X-ray that we have find that previously that it was pneumonia, but uh, we noticed that it was a normal finding of regarding this age group of the child. So it's a case of the thymus shadow. Have you ever heard about this condition, the thymus shadow?
So, no, no, doctor, I'm hearing it for the first time. So, what's that?
Well, I am here to reassure you about this normal variation and normal presence of this gland. Let me reassure you that at this age group, there is a gland that is situated just behind the chest bone, and this is responsible for the safeguarding and it's play an important role in the defense system of the body. Am I
Mhm.
understandable up till now, Mr. Crickbright?
Yes, doctor, I'm trying to understand.
Okay. So this is the normal variant according to his age, and sometimes we consider it that it's a pneumonia, but this is a shadow of this gland.
Would not believe this, doctor, what you are saying. The duty doctor yesterday night told
Mm-hmm.
me that
Mm-hmm.
Jackson's that Jackson condition is very serious. We need to admit him. But I was
Mm-hmm.
repeatedly telling him that
Mm-hmm.
he is having cough and cold and just mild fever. But he kept on insisting me that no, it is
Mm-hmm.
not like that. It is pneumonia, and
Okay.
Jackson need to be admitted in the hospital. And
Hmm.
now you have come and you are telling me that everything is fine.
Well, Miss Crickbright, I want to tell you one thing that at that time when he was entered into the hospital, he has the sign and symptoms of cough and fever. So that's
Mm.
why we admitted him. And although he improved after that, after receiving the treatment also, uh, but I feel very sorry because this happened, and this is that it can happen. That sometimes that it's very difficult to find out that it is a thymus or it is a a pneumonia. Am I clear up till now, Mr. Crickbright?
Yes, doctor, you are quite clear, but what about
Hmm.
uh, the antibiotics which you all were giving to my son? And in fact, he doesn't need all those antibiotics. So what about that?
Hmm. Yes, your concern is very right, and receiving only 2 doses of IV antibiotics will not affect him a lot. And although we are here to observe him and to monitor him in very vigilance way. Are you with me?
Mhm.
Right?
Doctor, whenever you all start antibiotics, you all tell a lot about its side effects. But now you are
Mm-hmm.
telling me that just 2 doses of antibiotics won't cause any harm. So are you
I
not
must have.
contradicting your own statements?
Well, Mr. Crickbright, I must
Three
appreciate your concern.
3 minutes left.
Yeah, I appreciate your concern, and I admit that this antibiotic has some side effects, but at this case we monitored him, and we will keep him in our vigilance. So, and it will not create a too much harm to his body.
Okay. So what are your
So,
plans
and
for him now?
Um, I must appreciate that how keenly you are asking the question. So actually, for our plan, that we just keep him observation for a while, and we just discharge him after discussing with our consultant, and there will be no harm to discharge him.
So you mean to say that you will be discharging him soon?
Yes, yes, of course. Any other
Okay. And
concern,
he's
Mr. Right?
no doctor. Frankly speaking, I'm quite confused, and I would like to talk to your consultant. So can you arrange my meeting with your consultant?
Ms. Crickbright, sure, of course, this is your right, and I will arrange a meeting with my consultant as soon as possible, so he will more clear your concerns regarding Jackson. So let's summarize that what we discussed up till now. Today we discuss about Jackson, who is a 9-month-old boy. He came with a complaint of fever and cough, and previously we thought that it was pneumonia, but after keen observed him, that we notified it was a thymus shadow. And although we have given her 2 doses of IV antibiotics along with the supportive treatment, the child has been improved. And we did apology on behalf of our team, but it was not anybody mistake. And we just observed him, and we are planning to discharge in as per consultant order. And Mr. McBride, I know that it's a strange situation, but I must offer you a leaflet regarding the thymus shadow, so you can have a that you can aware about this condition, that there is a gland, you can learn about that, or you can know about that. How it sounds?
Okay, doctor. But please arrange my meeting with your consultant.
Of course, sure. And there is a leaflet regarding this condition, the thymus. So
The time is
the
over,
leaflet
doctor.
along with the,
Neta.
yeah, thank you.
Okay. Okay, Dr. Neta, would you like to give yourself feedback first?
Hello.
Yes.
Yeah. I think it was okay. Not that much bad, but the father was very what should I say, asking question and question, like in our setup, like the parents keep asking questions.
I told you that my wife kept on calling me. She is quite worried about Jackson. And then your reply was, I appreciate how keen parents you are. How, okay, so instead of that, you should have told me, yes. I can see how worried you are,
Mm-hmm.
right?
Mm-hmm.
Okay, then during communication, instead of Mr.
Mm.
Kirkbride, you once told Miss Kirkbride. Okay. And then you told me about 2 doses of antibiotics. Okay. So I told you that, it was not mentioned that how many doses of antibiotics were given. So don't
False
make up.
information. Yes. Yes. Yes.
Yes.
Yes.
So don't make up the information which is not given in the scenario. Okay.
Okay.
So I told you that. So you told me that 2 doses of antibiotics were given. So at that point, you should uh, have told me that, Mr. Kirkbride, I'm really sorry, and I understand your concern about uh, being given antibiotics, and which should not be given. But the moment we realize that it is not pneumonia and it is thymus shadow, we have discontinued it, and we won't be giving it further. Okay. And
Okay.
usually, and usually, when we give antibiotics, usually we don't monitor for that. Okay. So what all antibiotics, unless and until we have given aminoglycosides. Okay. So what all monitoring they do it for gentamicin. Okay. Otherwise, they don't give. And here, what all antibiotics they would have given, that was according to the weight of the child, isn't it? Though it is not mentioned, it is. So that also we have to keep in mind while we have to do this communication. So here your task was to discuss chest X-ray findings, and then after that you have to uh, accept that we have with discontinued giving further antibiotics. Okay, and as it was mentioned in the scenario that after discussion with the consultant and uh, after going through that pediatric early warning score, that it is decided that we will be discharging the Jackson. So that also you can mention.
Yes, I already mentioned that we will discuss with our consultant and we'll discharge you.
Okay, right.